if we truly look at what pays dividends when you rejuvenate, it's the eyes. That's the first thing that people see. It's the first thing I noticed when I look at people. You're drawn to their eyes. So this is what we tell people. So this is also, if we take a look, it's one of the first procedures that brings somebody in, and this is where they really see aging as well up front. And it's one of the first places I analyze on a patient's face. So as I look at them, I end up looking at that periocular complex and looking and seeing what types of things can be done to rejuvenate that area. And there's a lot, the range or the spectrum of things that can be done is pretty wide. We have, for example, Botox around the eyes. Makes amazing things. A little Botox can get a little bit of a brow lift in the corner, soften these lines up in here. Voila, bada bing, bada boom. Simple, easy. You know, we have a little bit of filler in this area. It's amazing what just a little bit of volume to kind of soften this little bone in that area, that little trough, really, really just spruces things up. Some patients may need a little bit more, okay? Cleaning up a little bit of excess skin on that upper eyelid is going to make a woman's eyes just pop. It just widens them up. It makes it look bigger. It makes them look more interested. And most of my patients will come back and tell me, they go, I feel more alert. People tell me I'm more awake. It's the first thing that I see, and it's also the same, at the same note, one of the things that pays the most amount of dividends. And there's simple things can be done all the way up to surgical procedures. Upper and lower blepharoplasty, I'm going to break them into separate categories. They fall into the category of eyelid surgery. They are simple, they're easy, they're done in the office. It is amazing. Upper blepharoplasty is probably the most gratifying, instantaneous boom that you can do to a patient. Takes less than an hour. It is done under straight local anesthesia. You can essentially drive yourself here, have your upper blepharoplasty, drive yourself home. Most of our patients are capable of doing that. It is almost as simple as taking a mole off. The skin here is almost completely insensate. You numb it up with a little bit of local anesthesia, take the skin, some fat out, close it up, and right there on the table you can show them the mirror and go, whoa. And it is that cool. It is, for me, it's one of the most gratifying things. And lower bleph is not that simple, but maybe 5 or 10% more. It is a simple procedure. We do it right here in the office. I do like to give patients just a little bit of oral sedation to do the lower bleph. I think it makes them a little bit more comfortable, and takes about an hour and a half. It truly is that simple. And very frequently, we end up doing uppers and lowers together because 2.5 hours and you have really, start to finish, starting with consents, photos, say hi, surgery, walk out of here, about 2 hours, and you've basically rejuvenated this whole box, and patients love it. Not only do they love it, it changes their life. From a very functional standpoint, most of these patients will say, I see more of the world. From an emotional, psychological, personal view standpoint, it really increases their self-esteem, and it makes them feel younger. It really gives them that oomph, that pow, that I'm a Cosmo supermodel. We want Cosmo supermodels. I want every woman I work on to feel that she can be on the front cover of Cosmo.